All right, it's time for Here's to Your Health on KUAM, wherever that may be that you're watching on TV8, TV11, YouTube, Facebook, KUAM News, KUAM.com, KUAM on Instagram. We are all over the place, and thank you guys very much for joining us. Joining me here in the Zoom room, no stranger to talking to her, we have Dr. Kelly Neal from American Medical Center. Doctor, hello and welcome to the show.
It's my pleasure. Good afternoon.
Now, we have talked before. When I was filling in for Chris on the link, we've had several conversations about a lot of topics that obviously you are somewhat of an expert in, Medicare being one from the clinical side. And so when we're doing this show as a standalone, I kind of wanted to reset. As I mentioned to you before we started, you don't want to kind of start watching a TV series halfway through the third season. You kind of want to go back to the beginning and start binge watching it. So that's what we wanted to do. We wanted to back it up a little bit, reboot the franchise, so to speak, and just kind of start from the beginning. So first off, let's talk about your role over there at AMC.
Okay. When I tell people, why they come into the clinic for an annual wellness, it's usually to, first of all, break the ice. And I tell them my responsibility is to make sure that they have every benefit Medicare has to offer. And as soon as I break the ice, they go, oh, sign me up. And so I've got them I've got their attention at that time. The annual wellness is not a mandatory appointment. It is a initiative by Medicare. It's annually, meaning once a year. So if they have it in December, we hopefully get them back by the following December. It does not have to be by their primary care. The goal is for me as a clinician to kind of put together a preventative plan. And that preventative plan to say, hey, I see these things. Let's see what we can do to keep you out of the hospital. Or, hey, do you need a walker? Let's see what we can do about your walker. In that visit, it probably takes about an hour, 45 minutes. We give them access to their electronic record, which is sometimes for my tender folks, like maybe 80s or 90s, they may not necessarily have any desire to go on a platform, but to our younger folks, let's say 40s, 20s, the great grandkids they're all, hey, do you have a warehouse that has all their all their records that are electronically? They tend to really like that.
And that would be good for someone who, maybe their parents or their grandparents are, getting Medicare benefits. So they can kind of keep track of where grandpa is or grandma is, make sure they're getting the meds, the services that they required, and that they're actually going to their appointments, which is pretty important.
Absolutely, because it's by claims data, which means every time somebody sees them, every 30 days, the data gets dumped into it. So it's basically a data dump. Every time I see the patient, give me at least 24 hours to finish the notes go in there. The patient has the ability to see everything we see. Fast forward to, there's the care coordination. So the care health coaches or the care managers will put their notes in it too and make their suggestions. So in case they didn't catch it on that conversation, it also is placed in there too. So there's a lot of things that platform holds and wealth information. Plus, it's also a warehouse of any other future and past visits can go in there. So let's say they go to the States and never come back to Guam, which is unfortunate, but they always have that warehouse that has all their information. So the annual wellness is a yearly evaluation for preventative care and wellness. We put together a care plan to keep them safe, not only from a health standpoint, but also from a safety standpoint, because the goal is to keep them out of the big house. Right now where I'm in clinic, and it's the Oka Clinic, but right next door is GMH. The goal is to keep them out of that hospital. And that's not always an easy feat to do.
And this is different from an annual physical or executive checkup with the primary, correct?
Correct. So it's more of and forgive me, it's more of the chit chat, getting to know them, what their risk factors are, how Medicare can help them. So often they think of it as this ominous element that they signed up for, but don't know anything about. That's kind of like marriage. It's like, okay, you signed the dotted line, but what is marriage about? I know I wasn't prepared for it. So what are we prepared over exaggeration, but what are we prepared for with Medicare? So I just kind of walk them through it. Yes, we get this big book every year that says Medicare 2021. That should be now starting to circulate again. But what does that mean for the patient? So that's just one layer of the onion. There's also that in that meeting, we have a heart-to-heart conversation, and it may go like this. In case your heart was to stop, do you want a full resuscitation? Do you want a breathing tube, or do you want a peaceful passing? That form looks like this pink, okay, very forthright. A lot of dialogue goes into this. It's usually, that dialogue is usually on the annual wellness. We fill it out. I hand it to the patient. We scan it into their electronic record. Again, they have full access to it, and we don't discuss it again until the next year. The other time we may need to discuss it is, God forbid, we have to give them a catastrophic or a terminal diagnosis, and that terminal diagnosis may mean they may have less than 6 months to live. That is appropriate time to go over it again, but usually they don't necessarily, and nobody really wants to think about it, but it's like, what happens? And so we kind of crack the nut on that conversation. Not always a fun topic, but a necessary topic.
Yeah, and you and I, we actually had this conversation at your clinic. I know doctor-patient confidentiality and all that, but I have no problems talking about it. But it is one conversation that you need to have with your patients, because those on Medicare, it's for a reason that they're either advanced in age, and these things just happen when you got a lot of miles on the clock. Conditions do add up. And other younger people like myself have a condition that got us into Medicare. So it's a conversation that you need to have. And that database you mentioned, it's like, think of it like your Facebook profile. Like, you update your status depending on your mood. You've updated your location or your workplace, wherever that may be. You need that current information. So like you said, any doctor that they visit will have that available to them.
Oh, absolutely. And they can take it to their primary care. Absolutely. So circling back to this thing. So let's say when you're definitely young and healthy, it may say, hey, full resuscitation. Let's pull up the tent stick, do everything we can. You got hit with the surfboard or something. But then on the fine print for, let's say, additional comments, it may look like this. And we talked about it at another show. If two physicians agree, there is no sustainable quality of life, discontinue life supporting means, then what it does is it makes two healthcare professionals to collaborate and make the decision. And then it kind of in collaboration with the family, but it offloads that burden, because there's nothing worse than having a family member having to make the decision to withdraw life support.
Yeah, so that's a big point that you've brought up before. Is this also lets the family know their intent, because family, we don't want to let go of our loved ones. We don't want to just say pull the plug. But if it's the wish of that loved one that, hey, I've gotten to this point, the family needs to know exactly where myself and my doctors stand on this.
Correct. So it's just to pull everyone together. What is the wishes of that individual? It has nothing to do with the crown jewels. It has nothing to do with the estate. It is called a POST, which is a physician's order for life-sustaining treatment. That conversation, Medicare allows us to traditionally bill and to have that conversation with the annual wellness. So not only with the annual wellness, we have the care plans to completely discuss on prevention of illness and looking at the health element of the patient, the annual wellness. And then thirdly, the biggest topic with that is what we talked about last week, and that was to sign up for chronic care management. Chronic care management is a care team that will call the patient once a month, and they will say, hey, Mrs. Smith, how's your arthritis? How's your hypertension? If they have congestive heart failure, did you gain 5 pounds within this last month? Because then we worry about fluid building up in the lungs and stuff. So you have a personalized team that is going by a rubric or a plan that has been put together at this wellness visit that specifically tailors to that person. So that first,
Before I had my appointment with you, the conversation I had with one of your team over there, it was pretty thorough. We went through all the medication I'm on, the treatments I'm currently on. You've done my dialysis schedule, and they even got into state of mind type questions just to kind of see where I was at mentally.
and you weren't too crazy. Oh,
Too crazy on a scale, that's patient doctor confidentiality. Don't tell everyone how crazy I am. But it was, it did kind of catch me off guard because sometimes you just, mental health, it gets pushed under the rug so often. Now, lately, we're really seeing that, this is such a huge part of people's lives. And when you do have a serious medical, physical condition, your mental health can take a beating. So it's good to know kind of where their head's at before you meet with them and find out the physical stuff.
yeah, because what you're referring to is I have a staff that calls you prior to meeting me, and I think hopefully that wasn't too offensive because
No,
what
no,
they're
not at all.
doing is they're asking you all these questions that helps to offload the time that you and I are spending or the patient and I are spending so that I get to get more down into the weeds. I'll take what that team has talked to you about and kind of decipher it a little bit more. And you know what, we have identified that that can be a little bit of a pickle because the team is talking to you before you even walk through the bay or here. It's like, well, I'm not going to say if I'm, depressed or not. I don't know who you are and you're on the phone, but what the team is actually helping me to do my job and to reiterate the fact that I can't do my job without them. And I certainly don't do it in a vacuum, but they're helping me to make the best use of that hour and why we can get so much more done.
And because it helps you, because I'm one that when it comes to doctors, full disclosure, I've got nothing to hide because the best possible treatment I can get is if they are armed with all the information they have. And another thing is that if someone does repeatedly take this little survey, every year before their wellness check, if you see a huge dip in their mental state, you think, well, something's going on, obviously. And this could be the manifestation of some physical discomforts that maybe I don't want to admit that is sore. But if you're more depressed, you went from maybe a 0 on the scale and you shot up, your depression is up to a 5, then, well, maybe there's something that you need to look at there.
Yeah, absolutely. So let's take that and run through that rabbit trail.
Yeah.
We had noticed that one of the patients went from one score to the other. Then it put sticklers on my side to redo it in about 6 months. And so somebody has, let's say, PTSD or bipolar or depression or anxiety. Instead of just one phone call a month, Medicare will allow me to have them have 2. Because what Medicare does, and they're starting to see the benefit of it then better now than they did, let's say 10 years ago. So they're identifying that can be a pickle. So they're saying, hey, you know what? We see that there's an issue. We're going to let that care manager talk to them twice a month just to make sure that their emotional health is stable. Now, I think we have identified maybe here on Guam, we need to probably bolster up our mental health here. I don't know how that's going to go on air, but we need to probably do a better job on mental health here. And I think we're going the better way.
I think because we're all making progress. We know that it's not something that is going to happen overnight.
Yeah. It's a momentum that we're all working on. Yeah.
So I think the main thing with Medicare is quality of life, whether that's mental or physical. And so, maybe if someone is 85, 90 years old, things might change in the year between, the time that you meet them. So is there like adjustments you can make to their Medicare if you realize that things are a little bit different, or is it just the one policy fits all?
There are adjustments. Let's say for, are we talking about their health plan or are we talking about their benefit plan?
I think the benefit plan, because the health, obviously, we know that you can adjust things. Hey, we're going to tweak your prescription out. We're going to maybe, put you on this program. But from the benefit standpoint, because you're coming from the clinical side of the Medicare, is there a way, I know that the admin paperwork stuff is probably a different office, but are there ways you can kind of tailor the Medicare?
Not so much from the admin plan. I figured once they get the package, meaning they get Medicare, there's different venues that they can participate in. So let's say all of a sudden someone gets sicker than snot and they now need to have Medicare D. So then what I do is I give them a brochure that says coordination of your benefits, and I can give them in contact to the person that can best assist them for Medicare D. And the best I learned how to say what D is, it's for D stands for drugs. So it's the pharmaceutical element, because before, let's say they were 40s or 50s and had Medicare, they were only on an aspirin or multivitamins, and they may not have needed the D component. But fast forward 30 years, it's maybe a different story. So I help them to put the right people in their circle of who's who to help them with those, to help them make the best decision, because you may find that the premium for D may be $200, but if they look at the medication, it's only worth $150. That may not be cost beneficial. So you always want to look at the cost ratio benefit analysis when you take a step back. And I'm afraid I'm not the right person for that. So the goal is
that's another thing, is that you help the people get in contact with these people that would be able to handle those type of things. When we had our meeting, I have part A and B now, and I do need D because, you know, as you said, the premium saved $200. One of my medications is about $400 a month. So cost benefit, that works for me. So I need to get that, but that is something that is handled by another office. There is the Medicare office here on island. I believe they're part of public health.
They are. Mm-hmm.
So you're good at that information, getting people in touch with those. I know you gave me several phone numbers and places to go and contact. So your kind of whole thing is that informational warfare, because you're just arming people with the best info they have so they can maximize their benefits. And again, it goes back to that quality of life.
It does. I almost want to correct you on your first statement that I was the expert. I don't know if I'm the expert. I just know a little bit about little things, because I want to let you know every year it's a grab bag. 2021 just rang in and I have no idea all the changes. We all find out at the same time.
Yeah,
we're all
I mean,
I didn't know that.
Yeah, well, that's government, you know. I mean, we change things, tax codes and whatnot. So let's go back a little bit to my deal with my disease and my kidney failure. I am on Medicare now. I'm only 44 years old. So before this, I thought Medicare was for people that are like 65, 70 years old. That's it, just for old retired people. I never thought that in my 40s, I would be on Medicare. So who exactly qualifies for Medicare?
A great question, because I did a show maybe the first 6 months I was here, and the broadcaster says, well, it's for all those elderly. And I thought, oh, okay. I said, do you think everyone that's elderly is 65? She goes, oh no, I'm going to be 65 next year. I go, well, you're correct. I don't think this, because anyone that's 65, I don't qualify as elderly. So your question
I still feel like I'm 25. So the fact that
you act like you're 25. Absolutely.
Yeah, true. Don't ask my wife. She'll say 12, but whatever.
So we have a Medicare car, and you'll see it around. It's like aging with grace. And I think that is so apropos, so poetic. It's aging with grace. So your original question is, who qualifies for Medicare? Medicare will take anyone that is permanently disabled. So I see patients that have schizophrenia, that are disabled because of PTSD or bipolar, and they're young, they're healthy, they may have a little bit of problem with society, but they're wonderful, active individuals, and they're just a joy to see. And then I also have people that are 100, 102 that are unfortunately bedbound, and then everything in between. So it really makes my life and my day unique.
Yeah, when my doctor told me, he's like, okay, technically now you're disabled. I was like, no, I'm not. I'm
Not
still a
a,
young dude. I feel fine aside from some internal issues. I feel fine. So, yeah, I mean, technically, yeah, brain.
it's a,
Well, let's,
it's a matter,
let's not get
it's a
carried
matter
away.
it's a matter of perspective. And so the goal is to keep them as active as possible, to change the perspective that just because they're on Medicare doesn't mean that we have to build the pine box in the backyard and look at it every day. It's exactly what we don't want to do. We want to keep them aging with grace and as
That's what
active
I
as
wanted to get, is that, this is not the, all right, well, you're done. Here's your Medicare, kind of off into the sunset. This is, again, quality of life. It goes back to it and maximizing those benefits. So it's going to benefit the people who, through, no fault of our own, have an issue, a condition that, we need this help. And, when they said, okay, you need to get Medicare, I thought, well, how am I going to qualify for that? I'm still young. And they're like, well, how long have you been working? So basically I've been paying into Medicare for, before I was even an adult. Started working when I was, I think, 15. So that kind of helped the process. Is that one of the requirements? Or, I mean, maybe that's a different office that can answer that question.
maybe you do have to had some type of contribute. You have to contribute it somehow or by the Social Security. Absolutely. Yeah. Um,
Yeah, I
and
think
I
that's what it
think
was. I
that's
mean,
yeah, because I actually had to go back to the civics books to find out when US acquired Guam, how did that roll over everybody into it? And I knew at one time that answer, but I on air, I want to retract because I don't want to profess my ignorance.
So, basically this, we could talk for hours and hours about all the little finer points of Medicare. Um, but we just wanted to kind of cover the basics here on the show. And I know that you have your sit down with your patients and whatever their concerns are, bring them up and you try to give them as much information as you can. But again, you don't have it all, and it's hard to kind of think of everything you want them to know. So what are some of the big questions that maybe your patients might have?
Is usually it is, why am I here? Okay, I got a phone call. Why am I here? And so they it's to let them know what the annual wellness is. That hopefully my staff has done, and they usually are really good about saying this is what the annual wellness is. They always like to hear it again.
Right.
It's like staff is telling them what annual wellness is. And I think through the broadcast that we're doing, being it out there, so it's not so skeptical. It's like, why am I getting called? We have patients that have come into any of the AMC clinics, so we have their numbers and we already know that they're Medicare. So they will get that phone call. And again, not to coerce, but just to say, hey, we know that you would benefit from this, and this is what this is a service that is offered to you, and Medicare will access it, so we can make sure that you're okay. So we do that. That's the first thing. Is that the biggest question? I have a list here because I asked my patients here. We already answered the other one is what does it entail, and it usually entails their itemized care plan, asking the durable power question or advanced directive question, and then also to sign up and make those individual care plans for their care coordination. And that is, excuse me, not the care coordination, their chronic care management team. So to qualify for that, you have to have at least 2 or more chronic conditions. And so we talked about that before. So that what that would look like, you for arthritis, okay, then you may have to have one other one. So it may be hypertension, it may be diabetes, it may be end-stage renal failure. It would be one other one. So there are 2 or more. Medicare wants to make sure you at least have 2 or more chronic conditions. Chronic means that it's not going to go away tomorrow. Okay, and that qualifies that, okay, we're in like Flynn, and that Medicare will send or have someone call you once a month. If there's any behavioral element like depression or anxiety, Medicare will say, okay, you get to be called twice. Okay, how do they reach me, or how do they get an appointment with me? I have that number still, I think. And that phone number is 648-9110. And they would just, the person that answers the phone would be from AMC, and they'll put you in on the next available appointment. And then anticipate. What really helps though too is to bring all your medications, so I make sure the doses, and we may have some dialogue around that, and I give that back to them.
And again, this is for pretty much anyone that is on Medicare. And honestly, I didn't even know that this was available. I just thought, well, if I go to my primary physician, that covers everything. But then from the Medicare standpoint, that's where you go in and fine tune these things. So if people, oh, I do my regular physical at the doctor, you still need this wellness check with you or another Medicare doctor.
So you kind of think of it like, okay, our bodies are a car. So, and if you think of it, I'm a mechanic. I'm only a mechanic of the body. With my car, all I need to do is put gas in the thing. That's all I need to do. That's all I do with my car. But what I do is like I look at a platform and say, okay, show me 1,000 miles. Okay, you should be ready for a mammogram. Did you get your mammogram? Okay, so many miles, you should have had your DEXA scan. Did you get your DEXA? So I just make sure that we are up on so many thousand miles. We've had A, B, C, and D. And if we are good, we're good. If we're not, then I fill in the pieces to say, okay, we need this, this, and this. I make it happen, or I make a list out, hand it to the individual, put it in the platform, which they can easily access. They tag it to the primary care, and we're good. If I see them once or twice a year, preferably about twice, because then at least I can make sure that it's kind of chiseling away that to-do list. We're good.
And, sometimes people take better care of their cars than they do of their bodies. So that's unfortunate, but yeah, still. So what other concerns do your patients have?
DME is a big one. And that's probably an argument that I'm going to probably lose, or we need to beef up. So after one of the podcasts that we did, I had a gentleman that needed a new hospital bed. And I just loved on him and said, okay, here's what we can do. Let's see how we can work on it together, because he's completely bedridden. And right now he's been renting it month by month. So that seems to, and I really, until I get more ingrained in the culture, I have no idea why. So DME seems to be, we talked about it again, I think on a CPAP machine, they have to rent it. It's a little difficult here with getting the DME, whether from a CPAP machine or a wheelchair.
DME is?
Durable medical equipment.
Okay. And some people need that. When I do start the peritoneal dialysis, I'm going to need that machine. So I don't know the story if I'm going to rent it or buy it or what, but that is a concern that a lot of people have, because, if grandpa is bedridden and needs the equipment at home, we want to be able to get that for them, but not break the bank. So there are programs in place, but like you said, there are gaps. And I don't know if there's legislation or anything that's in the works that's going to possibly fill those gaps. But you work with the people and try to figure out on an individual basis. This is not an umbrella Medicare, one size fits all. You work with the patient. That is the whole point of these wellness visits.
Yeah, and to be honest, I'm honest enough to say, I'm finding out as we all go along. If we can have a big warehouse to say, okay, when you're done with the bed, let's put it back here and recycle it if we need to. But I'm learning along as well.
Yeah, and I think we all are. And this little segment here is going to help me learn quite a bit, because when I did sign up, it was like, okay, you're on Medicare. Okay, now what? I had no idea. And just by chance, the interview with you on the show, you had Pua contact me, and we got the ball rolling on my wellness check. So people need to reach out.
Brother.
Yeah, people need to know that, if you are on Medicare, it's not just a set it and forget it thing. It's different from your primary physician. So to maximize your benefits, maximize your quality of life, you need to have this wellness visit. So you can see Dr. Neal here, or anyone at, how many other Medicare doctors are there at AMC or here on Island? Do you know?
We have the one that's certainly more talented than me, and that's my boss, and that's Dr. Tren. He's currently here on Island. He'll be here for about 2 weeks. So he's more the MD. I'm more of the more the administrator. So my doctor is more clinical, PhD rather than MD. So he's so your original question is how many are there for AMC? Two.
But you can make time for any people that need your services. So again, the number is 648-9110. Call AMC, set up an appointment with Dr. Neal or Dr. Tren, get your wellness check, make sure your Medicare is on the up and up. And anything else you wanted to let the people know before we let you go, Doctor?
No, we're good. Happy Monday.
All right. So I'm sure we will both have questions next time we talk, and you'll have some more ideas of things you want the people to know. So we'll cover that next week. But here's to your health. Dr. Neal, thank you so much.
You're very welcome. Bye-bye now.
All right.
Yeah.